So I'm Dr. Mary Davidian, and this morning I was asked to speak to you about what it's like being a doctor with dry eye and how that affects my perspective and the way that I speak to my patients. As you've already heard from members of our panel, I'm not alone. And in fact, if you've been impacted by this disease, it has a very profound effect upon how seriously you take it and how you speak with your patients. So I'm the medical director and founder of Highland Ophthalmology, which is in the Hudson Valley of New York. And our practice comprises 4 ophthalmologists, 1 optometrist, an optician, and about 20 staff members. These are my disclosures. So my personal story, what caused me to take my dry eye seriously and start treating it? So I will tell you that for many years, and probably like many of my patients, I really didn't take my dry eye very seriously. I would, occasionally use teardrops when I was really symptomatic, and I would kind of say, it's not that bad, it's not that big a deal, and I really don't have the time for this. And then about 2 years ago, I got to the point where my eyes were so dry that I realized I was extremely uncomfortable wearing my contact lenses, and I just couldn't do it for the entire day. And it really caused me to have a panic attack because I said, oh my God, how am I going to do surgery if I can't wear my contacts? I really have to start taking this seriously and addressing it. And so I did at that point, and I put myself on a whole regimen of treatments. And I noticed that it really did make a difference. It made me stop thinking about my eyes and being aware of my eyes, and I was really so much more comfortable. Shortly thereafter, I actually went to the ACES Caribbean Eye meeting, and I had the privilege of being invited to a small dinner where Patty Barkey and her group were speaking about starting a dry eye center of excellence. And that really motivated me to start thinking about, well, why don't I implement this in my office and really do this in a standardized way for my patients? Because I know that there are many patients like myself for whom this is a serious problem. They're probably not taking it as seriously as they should be. And in fact, I think many of my colleagues don't really take it as seriously. But clearly, there's a need for it. So I think it's fair to say that there is a stigma attached to having dry eye disease. For those docs who just kind of throw teardrops at it, as Johnny showed you the various selection he had in his pocket, take one of these and see what works, and you're done. When the patient comes back and they keep voicing that they're uncomfortable, they may be made to feel like they're just a bit of a complainer and they're kind of blowing it out of proportion. I think that often this causes denial and avoidance of treatment on the part of the patient. I can tell you just as an example, when I was preparing to come to this meeting, I was at a family event, and I told an older cousin who's a business executive, I'm getting ready to go to the academy, and I have to go home and work on my talk. He said, oh, what are you speaking about, Mary? I said, I'm talking about dry eye disease. And so he kind of smiled and smirked and said, is that really a disease? And, I think that is the attitude, even among educated people as well as among some physicians. And, as one who has suffered, I can tell you wholeheartedly, yes, it's a disease, and those who suffer from it really need your help. So discussion with the doctor confirms to the patient that it is real bona fide disease that deserves to be taken seriously and treated. And I think that when you speak to the patient about your own situation, it really causes them to become more adherent. I certainly will not do this with every single dry eye patient that I treat, or I would never go home at night because I'd be talking all day. But when I find that a patient is really getting frustrated and having a hard time being compliant and giving me every excuse in the book, I may turn around and say to them, well, I too am a dry eye sufferer, and let me tell you some of the things that I have done and some ways that I have handled it to help me be compliant, because I'm really busy, just like you are. And I think that describing your own personal situation brings the topic down to a personal level to make it more like two friends discussing a mutual problem rather than a doctor lecturing to a subordinate, which doesn't tend to go over real well. So I will share my personal story, as I said, when I sense resistance, anger, or noncompliance. So anything that legitimizes what the patient is feeling will increase their compliance, and many of them may have been used to their doctors not taking them seriously. When they find one that does, they are truly grateful, and they're more likely to take that doctor's advice. I think it also helps for them to know that doctors are real people, and we're not immune from any disease process or any of the many life stressors that they face that can make being compliant rather difficult. But that, in fact, we have suffered from the same symptoms but found ways to get relief. So what are some of the things that I may discuss with patients? What are some of the concerns that they may have? Well, patients may have concerns about the side effect of taking drugs, and I'll get patients who say to me, I don't take anything. I'm a very holistic person. I don't like to take medication. And I'll tell them, well, I'm the same way. And quite frankly, for me, just using teardrops alone didn't do it. I was still uncomfortable. It still affected my quality of life. And ultimately, I ended up taking Restasis twice a day, and it really helped me. I feel it's a very safe drug. The risks are minimal. There's no increased risk of glaucoma, of cataracts. There's no systemic absorption of the drug, and studies have shown that serum levels are not detected. So I really feel comfortable using it, and I think that you should give it a try. Patients may have concerns about the time commitment involved with treatment. And I kind of smile as my patient has watched me do loops around the office that morning, and I say, yeah, I know what it's like to be really, really busy. But if you want to be comfortable, you have to do certain things to increase your compliance. So one of the things that I do is I'll take my Restasis and I'll put it in a little Dixie cup, and I put it by my toothbrush. And by doing that, I know that I'm going to brush my teeth every morning and every evening. And even if my kids come into the bathroom to talk to me while I'm brushing my teeth and I'm totally distracted, I'm going to have that visual cue of seeing my Restasis there, which is going to remind me to do it, to take it. And I will tell my patient, why don't you go ahead and try that? I found that it really helped me. I have another colleague who's an ophthalmologist who takes Xiidra twice a day, and she also uses the Dixie cup next to the toothbrush method. And she noted that, when she takes her Xiidra, immediately afterwards, she'll get a slight taste in her mouth. So she finds that brushing her teeth right away helps get rid of that taste, and by the time she's finished brushing, it's gone, and that helps her to be compliant. Patients may also express to me that they have concerns about treatments being painful. And in that case, particularly when it comes to a LipiFlow, I will relay to them that I, too, am somebody who had horrible meibomian gland dysfunction. I was told by my rep, my LipiFlow was the worst she's ever seen. I don't know, Johnny, I may be in competition with you. Nonetheless, when I tell the patient this is a quick treatment that takes under 15 minutes, I had it done myself at the end of a very busy work day. It was totally painless. I was able to drive home in the dark by myself with perfect vision. It makes them feel more comfortable about considering proceeding with the treatment. I also emphasize to patients that dry eye disease is multifactorial. So we know that with this disease process, as with many others, everybody kind of wants that magic bullet, that one treatment that my doctor is going to tell me to do that nobody else told me about that's just going to cure me and make all my symptoms go away. So I try to emphasize to the patient that unfortunately, as much as I would love that for myself, there is no such thing. And so there are multiple things that you must do as part of your treatment regimen if you are a dry eye patient in order to get relief. And then having this one LipiFlow treatment, for example, is not going to make it possible for you to stop your teardrops, your medications, your hydro eye, and anything else that you may be taking. So if the patient understands the reason for each intervention, then compliance and success are enhanced. And I believe, as my colleagues do, that this involves a team approach in the office. And this starts with the technicians and the line of questioning that they pursue with the patients and the detailed history that they take, which includes treatment modalities that the patient may or may not have used up until this point. And certainly every patient leaves the office with written material, with a written flow sheet describing to them exactly what is expected, which I think indicates to the patient how seriously we take their disease. I've also found that showing diagnostic information, confirming that the patient has real disease, can be extremely helpful for those who have become frustrated. So once again, as part of our protocol, my technician will typically take the patient into the exam room and do a lipofew, and they'll start the discussion with the patient about what is normal. And then that patient's image appears on this huge flat screen TV right in front of them. And when they see this and they're told, well, these are their glands as opposed to the normal they just saw before, it doesn't really take a rocket scientist to know that they have significant disease and that, in fact, there is a medical basis that confirms why they're having a problem and why they feel what they feel, which will make them be more compliant with doing what you ask in order to feel better. So sharing that you're a dry eye patient and that you understand the suffering of your patient can strongly increase compliance. At the same time, I would like to say, for those of you who are not dry eye patients, I think simply taking this process seriously and showing the patient that you sympathize with them, that you're going to listen to them, and by establishing a dry eye center of excellence and having a standardized protocol that shows that there is a disciplined approach to treating this disease, will be a win-win for both you and the patient. That patient is going to leave thinking, this is the first time somebody really took me seriously and gave me relief. They're going to refer other patients to you. You're going to have the satisfaction knowing that you have helped those patients, and it's really going to help the bottom line of your practice financially because we now have so many things that we can offer to make these patients better. So thank you for your time.